Oh.
Thanks for staying with us. Dr. Todd Schlesinger, board-certified dermatologist, is here to talk about dermatology and your skin. Thank you for joining us.
Thanks for having me.
Hot topic. Everybody's interested in looking better, especially as summer has wound down. The fall is here. Time to get ready for the holidays. What types of trends do you see right now in your office? You always see BOTOX.
We always see BOTOX. We're seeing an increase in the number of people that are coming for the little procedures. I think with these economic times, people are staying home more.
Right.
And they're tending to come in for little things like BOTOX, intense pulse light treatments to remove dark spots, sunspots, sun damage, pigmentation in the skin, blood vessels. We also do a lot of vein work, sclerotherapy, which is leg vein treatments. We're seeing quite an increase in that as well.
Okay, let's start with BOTOX, and Joe's got some good before and after pictures for us. Just kind of run down for people who are joining us what BOTOX is, if they don't know a lot about it, in general terms, and how safe it is, does it hurt, that kind of thing.
BOTOX is very safe. It's basically what we call a toxin, but it's from the bacterium. And the toxin from the bacteria prevents transmission of nerve impulses from nerves to muscle.
Okay.
So it's injected underneath the skin into the muscle, and it stops the transmission, which allows the muscle to relax and allows your wrinkles to relax as well.
Pretty safe. I mean, some people say, "Oh, I don't want that injected into my face," but
some people will think that when they hear the word BOTOX, they think of botulinum, but BOTOX is actually incredibly safe. It's a very pure protein. There's no bacteria, it's completely sterile, and it's injected almost 4 million times every year.
Okay, and Joe, if you'll pop those pictures up for us, we can see the before and afters of, there you go, there's somebody scrunching their forehead. So that's kind of a typical
That's a typical result. Forehead injection, usually between 4 and 6 injections. The most common area that's treated is the area between the eyebrows, or what we call the glabella, which is here. The other area that's very commonly injected is what we call the smile lines, or the crow's feet right here.
Okay, if we can go to the after. There we go.
There you go. It shows an after picture. It's a typical result with the smoothing of the lines. Patients may also see that over time, if they continue their BOTOX treatments, that the lines will stay smoother long term. May help stave off another procedure down the line, such as a facelift or other procedure that they may have. They can keep the BOTOX maintained.
Are you seeing people doing this earlier and earlier? I mean, is in your 30s too early to start BOTOX?
It's not. Anytime's really okay. I mean, we generally wouldn't treat anyone younger than the age of 18. The FDA has approved BOTOX.
Under 18. I would hope nobody under 18 is coming to ask for it.
Between 18 and 65 is the indicated, the FDA approved age group that we can treat. But most people will start coming in their 30s, 40s, and 50s. The BOTOX is injected every 3 or 4 months, and many people will notice a longer response if they maintain their treatments.
Okay, that sounds good. All right, dermal fillers, another very popular thing right now. Who would use a dermal filler, and kind of what areas of the face are most common for fillers?
Fillers are a very hot topic, and there's a lot of new products coming on the market now. Europe always is the testing bed for fillers. They have hundreds of fillers available. We have about 5 or 6 different ones that we now have access to. And they fall into basically 3 categories. There's collagen fillers.
Okay.
And then there's what we call biostimulators, which actually make new collagen. And then we have the volumizer fillers.
Okay.
They are used in the central part of the face to fill the lines here, what we call the nasolabial folds.
Okay.
We also use them around the eye area to fill this area to give the cheek a more youthful appearance.
All right, and we'll pop these pictures up too, Joe, if you could throw up our before and afters. Okay.
And a hot area is definitely the lips. The lips are filled in with products that are available in what we call hyaluronic acid. And hyaluronic acid is basically a sponge-like molecule that the collagen of your skin is bathed in all the time, and that attracts water. So these fillers have been what we call cross-linked, so that way when you inject this molecule underneath the skin, it stays in place for approximately 6 to 9 months and gives volume to the face. This is a volumizing filler. So this person had areas where there wasn't enough volume in the face, and we now see that volume is very important for
And that's a pretty
appearance.
dramatic result right there.
But that result took 6 to 9 months to achieve what we call biostimulator filler, which means this filler makes new collagen underneath the skin by stimulating the body to make new collagen around tiny sugar particles that go underneath the skin.
Okay.
So with this filler, we treat, and then we wait a month, and we look and see the result. We treat a little more, so we build it gradually over time.
So once that person gets that desired result, that second photo of the man, Joe, if you'll put it back up, how long will that last?
That can last 2 to 4 years.
So he's good to go for a while.
So there's a trade-off with fillers. Fillers that give you an immediate result, maybe last 6 to 9 months. We have new products that are coming out that will last 12 to 18 months.
Okay.
Fillers that give you a longer-lasting 2 to 4 year result for volume can take 4 to 6 months to see the final result.
What type of new fillers do you have coming out?
There's actually a new filler coming on the market now by a company called Colbar, which has now been taken over by Johnson & Johnson, called Evolence. And that filler is based on the pig tendon, which is type 1 collagen, same thing in the human. Pigs are very, very close to humans in the structure of the collagen. So this is, again, sugar cross-linked with the sugar.
What's the benefit of using something like the pig versus and synthetic, rather?
Well, it interacts better with human tissue, which means that it will not cause a reaction in the human tissue at all. There's no skin testing required in advance. The studies have proven the filler to be very safe and unlikely to cause any reaction. But the other advantage is it lasts longer. So instead of lasting 6 to 9 months, it can last now 12 months.
Okay. Fractional laser resurfacing. What is that, and how is that different than other laser resurfacing methods that we've used in the past?
Fractional laser resurfacing was actually originally talked about in the 70s, but it's a method in which we divide the laser beam into tiny little beams instead of removing the top layer of the skin all at once, and it has a long healing time. By dividing the beam into small beams and leaving some normal skin between, the skin can heal much faster.
Is that used for somebody who has precancer areas on their face, or is this just purely a cosmetic thing?
It's a number of things. I mean, it can be used for, it's not indicated for the treatment of precancers like by the FDA as a medical treatment, but it certainly helps. But the number one reason we use a fractional resurfacing laser is to treat wrinkles and abnormal skin colorations.
Okay, and we have a photo of a lady's neck too, and I'd like for you to tell me exactly what's going on with her and what you've done. There you go. There's the before, and you can notice in the neck area.
There's actually a little bit more of extra skin, and there's a loose skin in the lower part of the neck here. That loose skin was improved and tightened by what we call Lux infrared skin tightening. As you can see, there's about a 25% improvement in the tightness of the skin. This is a non-invasive, non-surgical, no downtime procedure that's done approximately 5 times, and it uses infrared light that's driven deep into the skin while the top layer is cooled.
Does it hurt?
This does not hurt at all. It's not painful at all. This is not a substitute for a plastic surgery neck lift, but it gives you a nice improvement without having any surgery at all.
For somebody who doesn't want to be cut on, this is a great alternative.
Right, and I always caution patients in that the results are very good and that they're 25 to 30% improvement, but they're subtle. They're not the same kind of result you'd see if you actually did a neck pull or you actually did a facelift or a neck lift. However, the skin quality is improved because the skin is actually thickened and it's healthier and it's better skin.
And do you find, though, that a lot of your patients do come in with certain issues that they want resolved, but they don't want to walk out looking like that they've had major things done to their face, that they say, you know, Dr. Schlesinger, I want something that's subtle that I'll just look refreshed, so that might be a good option?
We call it downtime. There's a difference between downtime procedures and no downtime procedures. Most of what we do in the office has no downtime or little downtime. When you get into what we call the ablative procedure, where you're actually removing the top layer with a fractional laser, you get a better result, but you will get some downtime, maybe 4 to 6 days, where you have to take care of the treated areas while they heal. But most are no downtime, and many patients would like to just be able to look very good for where they are in life. They're not looking to be 20 years younger than they are. They just want to look good.
Right. Tell me about this, and I was just thinking, chemical peels. Do people do those anymore?
Actually, chemical peels are a little bit on the resurgence. It's interesting. Some of the deeper chemical peels are not used as much because of the higher risk of side effects and unpredictability of those peels, or risk of different colors in the skin. But now we're seeing a resurgence of the lighter peels. We're doing some research actually with an Italian company with a set of peels that uses 5 different sugar-type acids in the peel in different concentrations for different skin types.
What's a chemical peel good for? Because I remember a Sex and the City episode where one of the girls had a chemical peel and had to stay under a big hat for weeks because her face was red and blue and peeling. And
That's called a medium or deep chemical peel. Those have fallen less favor into the lasers. But we use a lot more superficial peels. They're used for acne. They're used for keeping the skin fresh and healthy, improving the appearance of fine lines or wrinkles, taking away sun damage, are very common uses for peels. And people are still getting them.
All right, so they're back.
As long as they're done safely by someone who is trained.
Should they hurt when you're putting them on?
You'll feel a slight stinging sensation, generally controlled by use of a fan.
Okay. Laser hair removal is also a big thing that people are getting into. Now is a good time in September for people to start getting into laser hair removal because they're not out in the sun quite as much.
Exactly.
How does laser hair removal work, and does it last forever?
Nothing's forever.
Okay.
Well, some things are forever.
Some things.
The laser removal works very well. What it does is it actually targets the hair follicle in the skin. So the hair follicle has pigment or color to it. And
Okay.
the laser can see that color underneath the skin, and it can then generate heat around the follicle, which kills the follicle.
Okay.
Now, it's generally done as a series of 6 to 8 treatments in most areas because the hairs have a resting and a growth phase,
Okay.
and the laser only gets the hairs that are in the growth phase.
Okay,
So
does
we
it
have to
hurt?
repeat
And
the
Joe,
treatment.
in the meantime, if you can pop some of these pictures up, does it hurt? Does it feel like a rubber band popping? Or?
That's a typical sensation people will say. It's very fast. We have 2 types of lasers in the office which work on all skin types. We can actually treat patients with tans now. We prefer to not treat someone with a fresh tan, but we can treat all patients from the lightest patients to the darker skin types, such as an Indian patient or an African American patient can be treated safely in our office. The one thing is not all lasers can treat those darker skin types safely.
Okay, and tell me about this person right here. They've had some hair on their face that you've removed. Or is this a common place for people to get laser hair removal?
This is a common area. The chin is a very common area to have hair growth in, especially women who in the 30s and 40s will develop hormonal changes. Some women have a medical condition called polycystic ovary disease, where their ovaries are putting out too much testosterone, and that causes them to have abnormal hair growth in those areas.
And that's not a place any woman wants to grow hair, so she can come in and have these 6 procedures, and it definitely lessens.
After the first treatment, they're going to already notice they don't have to mess with it anymore. The hair is going to be gone, but then they're going to have the repeat treatments to maintain the results. As far as longevity, you asked, generally the results will last at least 2 years, and at that point, they may just need a touch-up or 2 to keep it controlled. If there's a hormonal aspect that's driving the hair growth, then repeat treatments will be necessary, but in many patients, they don't need repeat treatments.
Definitely a lot better than waxing, though, which you have to do every few weeks, and it's
easy.
extremely painful. What about somebody with blonde hair? I mean, a lot of blonde hair. Say you wanted laser hair removal on my arm. Would it work if I'm so fair?
That's the challenge. It's not so much the fairness of the skin, it's the lightness of the hair. The lighter hairs have less pigment for the laser to see. So blonder hair types don't respond as well to the laser, so we have other techniques we use and creams and things to help those patients.
To help people like me. Okay. We've also got some great photos of tattoo removal. A lot of people get their tattoos early in life and then end up having regrets about it. You see a lot of people this time of year or in this day and age coming in with those regrets.
You'd be surprised at the variety of reasons people come in for tattoo removal. Sometimes it's the regret of having a tattoo placed on when they were younger or whatnot, but sometimes they actually want to change it. They want to have it off so they can put a different one, or they want to change the appearance of it.
Or maybe it's been someone's name. Have you had any names that you've taken off? And
the symbols you would not believe. We have everything from names to sometimes people have markings from, groups that they're in. Sometimes it's just an image of a grandfather or a loved one or whatnot, and sometimes it's just a decorative image.
you see all kinds of things, don't you?
Fascinating.
Those pictures, how long did it take to lessen the appearance of that tattoo that we just saw?
That was 6 treatments. That
Okay.
was done over a period of, I think the date's right on there. That probably took 4 or 5 months to complete that treatment course.
And how is that done? With a laser?
That's done with the laser.
Okay.
It's a different kind of laser. It uses a very short pulse. It's almost like a snap. It drives a lot of energy into the ink, and it actually explodes the ink particles underneath the skin, and it causes the body to come and take them away. It's a natural process that's just being accelerated by the laser.
How painful is that?
It's just like getting a tattoo on,
Okay.
except we use powerful cooling methods to eliminate the pain.
So if you could get it on and you
get
want
it
it off, then this is what it's going to take. But a very good option for people who do want to turn back time and maybe change their decision.
Yes, ma'am.
Okay. When we come back, we'll talk about some of the newer technologies available. Stay with us.